A new poll revealed that nearly half of Americans still doubt the safety of vaccines. The survey from the American Osteopathic Association found that more than 80% of people were in favor of vaccines, but 45% still have safety concerns based on online articles, distrust of pharmaceutical industry, and also information from doctors. In this week's Your Health Matters, 41 Action News anchor Lindsay Shively talked with a doctor, Brad Kramer, with College Park Family Care about concerns over vaccines.
Is it really important to get vaccinated, doctor?
I would say absolutely. It is important to get vaccinated. Vaccines for children can help prevent outbreaks like we've seen in the past few years with measles and with the whooping cough. There are children that can't be vaccinated if they're under a year old for certain things. There are children that can't mount a response to vaccination. And then there are people in our communities that are high risk for infections that children could give them if they're not vaccinated.
So people that can be vaccinated, if they're not, could potentially make people who can't be vaccinated ill.
Absolutely. Yeah. So it's not just protecting the patient who gets vaccinated or the child, but the community around them. So family, infants in the family, friends, or grandparents, absolutely.
Yeah, and you hear a lot of fear these days around vaccinations, worries that it could lead to potentially other illnesses, even fear going around and questions of whether or not vaccines could lead to autism. What do you say about that?
Absolutely. I've heard the concerns before, and I think that side effects with vaccinations, we see them, and that's not uncommon. You can get redness at the injection site. You can get some discomfort. Some people will have fevers for a day or so after a vaccination, but as far as the link with autism, they've done studies to look at that specifically, and scientists have found no evidence, no connection between vaccinations and autism.
No link.
No link. They've looked at vaccinated populations and then unvaccinated populations, and the rate of autism is increasing in both. And we don't know all the reasons why, but I imagine there's a number of them. But environmental exposures and hereditary reasons are probably part of that answer.
So if somebody is sitting at home and they are concerned, they're on the fence about whether or not to get a vaccination for their child, just what's your final message for them?
Yeah, so I would say absolutely vaccinate children. I think that it's critical that we do to prevent outbreaks like we've seen in the last few years, to keep the children that we can vaccinate healthy, as well as the ones that we can't vaccinate healthy, and to prevent other family members from getting the illnesses that we can vaccinate for.
All right, doctor, thank you.
Thanks.